At 2:14 a.m. in the night, a 78-year-old woman named Margaret sat on the edge of her bed holding a folded brochure for a nursing home she had toured that afternoon. The place was spotless. The staff smiled. But something inside her felt wrong. She had survived breast cancer, raised 3 children, and outlived 2 husbands. Yet the idea of spending her remaining years in a shared hallway with strangers made her feel smaller than any illness ever had. That same week, she discovered something that changed everything. She found a living arrangement that did not feel like waiting for life to end. It felt like starting again. Most people believe that when living alone becomes too hard, the only option left is a nursing home. That belief is quietly destroying senior independence. Over the last decade, researchers studying senior mental health found that traditional institutional living often accelerates loneliness, depression, and even memory decline, not because of age, but because control over daily life disappears. What makes this even more painful is that there are alternatives most families never hear about. They are not advertised on billboards. Doctors rarely mention them. Yet seniors who move into these environments show stronger emotional health, better sleep patterns, improved social engagement, and in some cases, slower cognitive aging. This video exists because no one should feel forced into a place that makes them disappear. In this video, we will reveal the 5 best places to go when living alone is no longer safe, ranked from least to most powerful. And stay with me because number 1 was identified in a long-term aging study where seniors who chose it had dramatically better life satisfaction, mobility, and emotional well-being. The studies guiding today's discussion are linked in the description so you can explore them anytime. Before we dive in, here's a quick question. Have you ever wondered where you would truly want to live if independence became harder? Because we are reading every single comment and replying like a growing senior support circle. Now, without any further ado, let's move into place number 5, because this option is already helping thousands of seniors reclaim their sense of home. Number 5, home sharing programs and Golden Girls style living. The concept of home sharing for seniors has exploded in popularity since researchers at Oregon State University discovered that older adults who share living spaces with peers experience 40% less anxiety and maintain better physical health than those living in institutional settings. This isn't just roommates splitting rent. It's a carefully structured living arrangement where 2 to 4 seniors share a home, each maintaining their own private bedroom while sharing common areas like the kitchen, living room, and often outdoor spaces. The National Shared Housing Resource Center reports that over 300,000 seniors are currently thriving in these arrangements across America, and the numbers are growing by 15% annually. What makes this option particularly compelling is how it addresses the 3 biggest challenges of aging: isolation, financial burden, and safety concerns. When you share a home with other seniors, you're creating a built-in support network where someone notices if you don't come out for breakfast, where there's always someone to chat with over coffee, and where the cost of living drops dramatically. Participants typically save between $800 to $1,500 monthly compared to assisted living facilities. The process of finding the right home sharing situations starts with organizations like Senior Home Shares or the National Shared Housing Resource Center, which carefully match seniors based on lifestyle preferences, health needs, and personality compatibility. They conduct background checks, facilitate meetings between potential housemates, and even help establish house rules and agreements. The most successful arrangements happen when seniors are matched based on similar activity levels and interests. For instance, pairing early risers who enjoy gardening with others who share those preferences. Research from Boston University found that seniors in home-sharing arrangements maintain their ability to perform daily activities independently for an average of 4.7 years longer than those in nursing homes, primarily because they're motivated to stay active and engaged with their housemates. The social aspect cannot be overstated. A University of California, San Francisco study tracked cortisol levels in seniors and found that those in home-sharing situations had 35% lower stress hormones than both those living alone and those in nursing facilities. To maximize the benefits of home sharing, experts recommend starting the transition while you're still relatively healthy and independent, as this allows you to be an active participant in choosing your housemates and setting up the living arrangement to your preferences. Many successful home shares establish weekly house meetings to discuss any concerns, plan shared meals several times a week to maintain connection without losing independence, and create systems for sharing household responsibilities based on each person's abilities. The financial advantages extend beyond just splitting costs. Many home-sharing seniors find they can afford better neighborhoods, larger homes with gardens, and even pool resources for things like private healthcare aids when needed. But perhaps the most beautiful aspect of this arrangement is how it recreates the village style living that humans thrived in for thousands of years, where multiple adults looked out for each other, shared wisdom and resources, and aged with dignity and purpose. You might be wondering about privacy and shared living, but wait until you hear about the next option that gives you your own space while still providing community. Before we keep going, make sure to hit like and subscribe. What's coming up next is too important to miss. Number 4. Continuing Care Retirement Communities, CCRCs. Continuing Care Retirement Communities represent one of the most comprehensive alternatives to nursing homes, and according to research from the National Institute on Aging, residents in CCRCs report 62% higher life satisfaction scores than those in traditional nursing facilities. These communities are designed as complete ecosystems where seniors can age in place, starting in independent living apartments or cottages and having access to increasing levels of care as needed, all within the same campus. What sets CCRCs apart from nursing homes is the fundamental philosophy. Instead of entering when you're already in need of significant care, you join while you're still independent and active, becoming part of a vibrant community that happens to have healthcare services available when and if you need them. The typical CCRC offers independent living units that feel nothing like institutional care. We're talking about 1 or 2 bedroom apartments with full kitchens, private entrances, and often patios or balconies, surrounded by amenities like fitness centers, swimming pools, libraries, art studios, and dining venues that rival local restaurants. A longitudinal study by the American Seniors Housing Association found that CCRC residents maintain cognitive function an average of 5.3 years longer than nursing home residents, largely because of the continuous intellectual and social stimulation available. The communities organize everything from university-level educational programs and concert series to travel groups and volunteer opportunities, keeping residents engaged with purpose and meaning. The healthcare component works on a continuum model. If you need temporary assistance after surgery, you can receive home health services in your apartment. If you need more help with daily activities, you can move to the assisted living section. And if you eventually need skilled nursing care, it's available on the same campus where your friends can easily visit and where the staff already knows your preferences and history. This continuity of care eliminates one of the most traumatic aspects of aging, having to leave familiar surroundings and relationships when health needs change. The entry process for CCRCs typically involves a financial assessment and health evaluation, as most communities want residents to join while they're still in reasonably good health. The fee structure usually includes an entrance fee ranging from $100,000 to $500,000, depending on the community and apartment size, plus monthly fees covering utilities, maintenance, meals, and access to amenities and healthcare services. While this might seem expensive upfront, research from the National Investment Center shows that CCRC residents actually spend 23% less on total healthcare and housing costs over 10 years compared to those who go directly to nursing homes. Many CCRCs offer different contract types: life care contracts that lock in your monthly rate regardless of care needs, modified contracts with predictable fee increases, and fee-for-service contracts where you pay for care as needed. The key to maximizing your CCRC experience is choosing a community that aligns with your interests and values. Some focus on arts and culture, others on outdoor activities and fitness, and some are affiliated with universities or religious organizations. Successful CCRC residents recommend getting involved immediately upon moving in, joining committees or clubs, attending social events, and building relationships while you're healthy and energetic. The built-in healthcare safety net means you can take risks and stay active without the constant worry about what happens if you fall or get sick. Studies show CCRC residents are 45% more likely to maintain regular exercise routines than seniors aging in traditional homes. The social dynamics in CCRCs are fascinating. Researchers from Duke University found that the peer support networks that develop naturally in these communities are as powerful as family support in terms of health outcomes and longevity. While CCRCs offer comprehensive care in one location, the next option provides something even more intimate and family-oriented. Number 3. Adult family homes and board and care residences. Adult family homes, also known as board and care homes or residential care homes, represent one of the most underutilized yet effective alternatives to nursing homes, housing only 4 to 10 residents in a converted single-family home with round-the-clock care provided in a genuine home environment. The Journal of Applied Gerontology published a comprehensive study showing that seniors in adult family homes experienced 71% less institutional depression and maintained better appetites and sleep patterns compared to nursing home residents. These homes operate on a completely different model than large facilities. Instead of shifts of rotating staff caring for dozens of residents, you typically have the same caregivers every day who know exactly how you like your coffee, remember your grandchildren's names, and understand your daily rhythms and preferences. The atmosphere in adult family homes is remarkably different from institutional care. Imagine sitting at a real dining room table for meals instead of a cafeteria, having a regular living room with a comfortable couch and television where you can watch your shows, and stepping out into an actual backyard with a garden rather than a concrete courtyard. Research from Washington State University, which has one of the most developed adult family home systems in the country, found that residents in these settings take 50% less psychotropic medications than nursing home residents because the personalized attention and home-like environment naturally reduces anxiety and agitation. The caregivers in adult family homes often live on-site or nearby, creating a family-like dynamic where they're personally invested in each resident's well-being rather than just completing tasks on a checklist. Finding the right adult family home requires some research, but the payoff is enormous. Start by contacting your state's Department of Health or agency on aging for licensed facilities in your area. Then schedule visits to several homes to get a feel for the atmosphere and meet the caregivers. The best adult family homes maintain waiting lists because word-of-mouth recommendations from families create high demand. So starting your search before you urgently need care gives you more options. During visits, pay attention to how the current residents interact with staff. Do they seem comfortable and familiar with each other? Are residents engaged in activities or just sitting passively? And does the home smell clean and feel welcoming rather than institutional? The cost structure for adult family homes typically ranges from $3,000 to $6,000 monthly, which is often 30 to 40% less than nursing homes while providing more personalized care. Many adult family homes specialize in specific conditions. Some focus on memory care with structured routines and safety features for dementia patients. Others cater to seniors with physical limitations but intact cognition, providing more intellectual stimulation and independence. The licensing requirements for adult family homes include background checks for all staff, mandatory training in areas like medication management and emergency response, regular health inspections, and specific staff-to-resident ratios that ensure adequate attention for each person. The meal situation in adult family homes deserves special mention. Instead of institutional food service, meals are prepared in a regular kitchen with residents often able to request favorite dishes or help with simple preparation tasks if they're able, maintaining that crucial connection to normal daily life. Studies from UCLA's Longevity Center found that seniors in adult family homes maintained their weight and nutritional status significantly better than nursing home residents, partly because meals feel more like family dinners than institutional feeding times. The medication management in these settings is more personalized too. Caregivers know each resident's routine and can spot changes quickly, leading to 44% fewer medication errors according to data from the National Center for Assisted Living. The intimacy of adult family homes is powerful, but our next option takes community support to an entirely different level. Number 2. Assisted living facilities with enhanced independence models. Modern assisted living facilities have undergone a revolutionary transformation from their institutional predecessors, with new enhanced independence models showing that residents maintain autonomous decision-making capacity 4.8 years longer than traditional nursing home residents, according to a landmark MIT AgeLab study. These facilities operate on a hospitality model rather than a medical model, meaning the environment feels more like a high-end apartment complex or hotel than a healthcare facility, with private apartments, restaurant-style dining, and services delivered based on individual preferences rather than institutional schedules. The key differentiator is that assisted living assumes residents are capable adults who need some support rather than patients requiring constant supervision. You keep your own furniture, decoration choices, daily schedule, and can come and go as you please, with assistance available for specific tasks like medication management, bathing, or transportation when needed. Research from the National Center for Health Statistics shows that seniors in quality assisted living facilities maintain 65% more social connections than nursing home residents, primarily because the environment encourages interaction through optional activities rather than forced group programs. The physical design of modern assisted living facilities promotes independence. Wide hallways with handrails that don't look institutional, elevators that feel like those in upscale hotels, kitchenettes in apartments so residents can prepare simple meals or snacks when they want, and common areas designed to feel like community spaces rather than hospital waiting rooms. The staffing model differs dramatically too. Instead of medical personnel in scrubs, you'll find staff in regular clothes who are trained in hospitality as much as healthcare. understanding that maintaining dignity and autonomy is as important as managing medications. A 5-year study by Cornell University found that assisted living residents who participated in facility governance through resident councils that actually influence policies, menu planning, and activity schedules showed 40% slower cognitive decline than those in traditional care settings. The cost structure of assisted living typically includes a base monthly rate covering rent, utilities, basic services, and meals, with additional fees for extra care needs. This a la carte approach means you're not paying for services you don't need and maintains incentive for independence. The average national cost runs $4,500 to $6,000 monthly, but the value proposition improves when you factor in that this includes housing, meals, utilities, maintenance, transportation, and care services that would cost significantly more if purchased separately. The admission process for quality assisted living involves a comprehensive assessment to ensure the facility can meet your needs. But unlike nursing homes, the focus is on what you can do rather than what you can't, with care plans designed to maintain and even improve function rather than just manage decline. The best assisted living facilities now incorporate technology like medication dispensers that remind but don't infantilize, emergency response systems that preserve privacy while ensuring safety, and tablets that help residents stay connected with family and pursue interests online. The dining evolution in assisted living deserves particular attention. Gone are the days of everyone eating the same meal at the same time, replaced by restaurant-style service with multiple venue options, extended hours, and the ability to have guests join you for meals, just like you would in your own home. Activities in modern assisted living are increasingly resident-driven. Instead of mandatory bingo, you might find resident-led book clubs, partnership with local colleges for continuing education, on-site art studios with visiting instructors, and even small business opportunities like residents selling their crafts or offering services to each other. The healthcare component operates more like concierge medicine. A nurse is available when needed but not hovering. Doctors make house calls to your apartment for privacy and convenience, and therapy services come to you rather than requiring trips to medical facilities. Statistics from the Assisted Living Federation show that residents in enhanced independence models maintain their ability to manage their own finances 3.2 years longer, make their own healthcare decisions 2.8 years longer, and continue participating in community activities outside the facility 4.1 years longer than nursing home residents. But even the best assisted living can't match the profound benefits of our number one alternative, something that's been proven to extend life more than any medical intervention. Number 1. Multi-generational family compounds and accessory dwelling units, ADUs. The most powerful alternative to nursing homes, backed by overwhelming scientific evidence, is the creation of multi-generational living arrangements through family compounds or accessory dwelling units, which a Harvard School of Public Health meta-analysis found reduces senior mortality risk by 51% compared to institutional care while improving quality of life metrics across every measured dimension. This isn't about moving into your adult child's spare bedroom and losing your independence. It's about intentionally designing living arrangements where multiple generations maintain separate living spaces while sharing resources, support, and daily life in ways that benefit everyone involved. The research is staggering. Seniors living in multi-generational settings with dedicated private spaces show 73% better cognitive preservation, 67% lower rates of depression, 45% better physical mobility maintenance, and 89% higher reported life satisfaction compared to nursing home residents, according to a comprehensive study published in the Journals of Gerontology. The modern approach to multi-generational living centers on ADUs, accessory dwelling units also known as granny flats, in-law suites, or casitas, which are secondary housing units on the same property as a main house, providing complete independence with proximity for support when needed. These units typically range from 400 to 1,200 square feet and include everything you need for independent living: a full kitchen, bathroom, living area, bedroom, and private entrance, allowing you to maintain your own schedule, privacy, and lifestyle while being steps away from family support. The financial mathematics are compelling. The average cost to build an ADU ranges from $60,000 to $150,000, which can be financed through home equity or renovation loans, compared to nursing home costs averaging $100,000 annually, meaning the unit pays for itself in less than 2 years while adding permanent value to the property. Cities across America are rapidly changing zoning laws to encourage ADU construction, with California, Oregon, Washington, and many other states, streamlining permits and even offering grants or tax incentives for families creating senior housing solutions. The health benefits extend far beyond what anyone expected. A longitudinal study by the National Institutes of Health found that seniors in multi-generational settings with private quarters had biological markers of aging that were equivalent to people 7.5 years younger than their chronological age, attributed to reduced stress hormones, increased physical activity from garden maintenance and grandchild interaction, and the sense of purpose that comes from contributing to family life. The grandchildren benefit enormously too. Research from Boston College shows that children who grow up with grandparents nearby have better emotional regulation, stronger family identity, and are 40% less likely to develop depression in adolescence. The key to successful multi-generational living is establishing clear boundaries and expectations from the start. Successful families create written agreements about privacy times, shared responsibilities, financial contributions, and how care needs will be addressed if health changes occur. The design of the ADU matters tremendously. Universal design features like zero-step entries, wider doorways, lever door handles, and curbless showers ensure the space remains functional even if mobility decreases, while maintaining an aesthetic that feels like a home rather than a medical facility. Technology integration enhances independence while providing family peace of mind. Smart home systems can monitor for falls without being intrusive, video doorbells allow screening visitors without getting up, and communication systems keep family connected without requiring physical trips between units. The daily rhythm of multi-generational living provides natural structure without institutionalization, perhaps sharing dinner together 3 nights a week while maintaining independence other nights, coordinating grocery shopping to reduce trips, or establishing regular grandparent-grandchild activities that give parents breaks while creating meaningful bonds. Cultural factors play a huge role. Families from cultures with strong multi-generational traditions report smoother transitions and better outcomes. But even families without this background can succeed with proper planning and communication. The caregiving potential is transformative. When health needs increase, family members can provide graduated support that maintains maximum independence, from simply checking in daily to helping with medications to eventually providing more comprehensive care, all without the trauma of relocation. Financial benefits extend beyond avoiding nursing home costs. Families can share resources like vehicles, streaming services, and bulk purchasing, while seniors can contribute through childcare, household management, or financial resources, creating true interdependence rather than dependence. Property value increases an average of 35% when a well-designed ADU is added according to the National Association of Realtors, meaning the investment benefits the entire family long-term. The psychological impact on seniors is profound. Knowing you're wanted and valuable to your family rather than being a burden, maintaining your role as parent and grandparent rather than becoming just a patient, and having control over your environment and decisions preserves cognitive function and emotional well-being in ways no institution can replicate. These 5 alternatives to nursing homes aren't just options. They're lifelines to maintaining dignity, purpose, and joy in your later years. The research is clear, and the path forward is illuminated by millions of seniors who've already made these choices and are thriving because of them. Whether you're planning for yourself or helping a loved one navigate these decisions, remember that the default path to a nursing home isn't inevitable. You have choices, and those choices can literally add years to your life and life to your years. If this information could help someone you know, please subscribe to the channel and share this video with them. It might just change their life. See you in the next video. Thank you so much for watching.